Serious, therapists of Reddit, what are some red flags we should look for in therapists? Not keeping professional boundaries, like sharing personal information about themselves, giving you direct advice about a serious decision, like a breakup, expressing their personal opinion strongly, any sign of judging your decisions, opinions or feelings. Therapist checks for messages during session. Therapist pushes their own religious views on their client. It's a stupid mistake, but it's common. Therapist discloses content of the sessions to third parties. Exceptions to this rule are consultation, clinical supervision, when a therapist seeks a senior or colleagues for technical advice, or when patient's life is at risk. Therapist flirts with client. If they are distracted at all, check a text or email or anything during session. If they can get you in immediately, it may mean they don't have many clients. This could either mean they are very new or not a very good therapist. Could also mean they had a cancellation, so do some research. Any kind of flirtation, it does happen. Get out of there, not helping you define goals to move forward. Some therapists are happy to take your money and just let you be about life for an hour. And while that might be a relief for you, it's only going to help long term if there are actionable steps taken that are agreed upon by you and your therapist. This is the work of therapy and most important, but also when many people drop out. Any kind of flirtation, get out of there. Can't stress this one enough. I wouldn't want a therapist with such low standards. If they immediately try to present you with answers to all of your problems, not lead you to your own solutions, there is a major distinction there. If they work in a lot of things about themselves and their lives. I had a therapist with ADHD who got his PhD before the internet with no meds at all, and it was honestly incredibly helpful to learn how he managed to cope, but that's obviously not the norm. I think there is a misconception that advice giving is what is most helpful. Therapists don't often give advice, but rather they offer alternative perspectives and create space for a collaborative approach to explore new ways of overcoming obstacles. We, as therapists, shouldn't ever assume we know what is best for a client to do. It is their life. If you have a therapist telling you what to do, I would have to assume there is an unhealthy power dynamic occurring which can have a variety of negative outcomes. Of course there is a time and place for advice, but usually that should come from a peer or family who are essentially at the same power level as you. Therapist here. My role is a little different as I am a trauma-based short-term crisis therapist, meaning I just help stabilize my clients to where they can be transferred to a lower level of care. To me, warning flags are no risk assessment, no crisis planning, no exploring triggers, no plan to help you cope when faced with a trigger, especially important when triggered and out of session, no timeline for treatment, no discussion about your rights as a patient, too much advice giving. I call this could've, should've, would've people. Also giving advice about anything outside of their scope of practice, medical treatment, religious practices, legal issues, etc. In family couples sessions especially, any therapist who acts like a referee to determine who is right or wrong. Covering these items are important in therapy because it will help the patient long term in processing emotions, using healthy coping skills and problem solving on their own. I can't speak to those clinicians in private practice because I'm in community mental health, but for agency-based therapy, it is not a long-term service. Most CMH agencies are bound by EBP, evidence-based practices, which are time-limited and short-term, 6-12 weeks. I would be wary of a therapist who seems like they are dragging out your treatment. The goal is progress, not perfection. If they start most of their responses with "at least" and then try to put a silver lining on it instead of honoring your pain and what you shared with them. Dang. I'm not a therapist, but I think I do have a bad habit of doing this when my friends are venting to me. I'm going to knock that off immediately. When your therapist is sure that you told them things you never did, and hold those things against you. Had a psychiatrist like that once. Glad I got a new one. The things she held against me made me look like I was actually crazy. She never held anything against me, but my therapist has thought I told her things when I didn't and insisted she's never heard of things people that I've mentioned multiple times. Therapist here. The big three are as follows. Talking about themselves in a way that is too detailed or detracts the attention and focus from you. Advice giving. We are not here to tell you what to do. not referring you on when an issue is out of their competency. For example, attempting to treat LGBTQ issues without training or skills with that particular population. I'd like to take this time to remind everyone that it's important to find a therapist with whom you can click. If their personality is a clash with yours or their modality doesn't work for you, it's fine to find someone else. Heck, it's expected. This is kind of my own personal style showing in a way, but I'm of the opinion that if every session the therapist is talking more than the client, there's something very wrong. It's a little normal for them to interrupt you to focus on something you said here and there, or direct you if you lose your way, but if they are yammering on and you can't even talk about what you wanted to, I'd say that's a pretty big red flag for me. That said, I'd still say give it a couple sessions before deciding on that, because the first session can often mean a lot of information gathering, so they have to touch on a lot of things. If they disclose more about themselves than you do, when used appropriately, it is usually a way to connect with a client. If every other sentence is "I've found in my life that," they aren't using therapeutic skills, they are just going off of their subjective experience to life. If they start pushing their religious beliefs on you. If they keep validating that it's okay you feel the way you do, but offer no alternative way of thinking. Keep in mind that a lot of therapists won't challenge thinking until rapport and trust is built. At the beginning of therapy, you both are strangers, so therapist validating you and working to understand the problem is an important part of the process. Therapist here, and I'm really sorry that some of you have had negative experiences with counseling. Not everyone is going to click and be able to build that rapport, but it's also the therapist's job to recognize when the rapport is not there or when we are completely out of the scope of what we are working with. It's important to realize what you specialize in and make that decision to refer to someone else more qualified in that area. It's hard to know sometimes when to refer because you want to give time for rapport building, but you also don't want to waste your client's time, and when you eventually refer it's frustrating for them to have to start all over again with a new person. An important thing I've learned is that sessions don't always have to be talk therapy. Hopefully you can kind of tell when someone's just not into it that day. Talking and psychoeducation are important, but sometimes I just play cards or do something not overtly therapeutic. Sometimes people feel more able to open up if you don't push them and let them do it on their own time. I'm not trying to waste anyone's time by playing games or doing other things, but sometimes it's therapeutic to just be present with someone. I had one adult male client who was struggling, and one day I suggested just coloring, sort of half joking, and he said, "That sounds goofy as frick. I'd love to. I haven't colored since I was little." We talked about just random things and I learned a lot more about him through the mindless activity. Another thing that is important is to not completely panic when you have someone experiencing thoughts of self-harm. You want to give them that safe space to talk about it. You can't panic and start looking for hospitals as soon as you hear the S word. Many people just want to be heard and want to reach out for help. It's important to talk it through because I've found many times they don't want to hurt themselves. It's general ideations of "I don't want to be here anymore." There's no intent or plan or means. But you wouldn't know that if you freak out as soon as they say it. Sometimes people use the word suicidal and don't completely understand what that means. Sometimes it just means frustrated or overwhelmed and they don't know how to express it. You have to be cautious definitely, and it's always good to staff with colleagues and come up with a safety plan and protective factors. People aren't going to feel comfortable talking to you if you jump too quickly. They may feel like they were being punished, and it makes you worry that they won't be honest about it in the future because they are afraid of the consequences. That's when you have to be concerned when you start scaring them off. As someone who really needs to see one to get to the bottom of some personal crap, gotta say it is unreasonably hard to find one, even in a major city like the one I'm in. Navigating that, across what my insurance will cover, and I just end up pushing it on down the road, really discouraging. As a fairly young therapist, it is not unusual that my patients are unsure about me being competent enough at my age. They will think you lack the experience of an older therapist that has been longer in the job and went through more life events themselves. I think it's important for me to listen to those concerns and, if it is their wish, give them my view on this matter. Usually that's all it takes for them to get more confident in my skills. I think a massive red flag is a therapist that is getting very defensive when confronted with concerns or critique. It's usually a big sign of trust if a patient opens up about those things and a chance not to be missed. If a therapist doesn't give you an informed consent, if a therapist doesn't thoroughly explain his/her informed consent to make sure you understand, if a therapist doesn't listen to your needs, if a therapist says they are a therapist, CBT, DBT, psychoanalytic, etc., and they don't listen to your individual needs, if a therapist reroutes all your problems back to some aspect of your life. For example, if a therapist tries to make every problem in your life about your orientation even when they are unrelated. Overall, if it feels like you aren't being heard and understood, red flag. More so, if it feels like the therapist isn't trying to understand your point of view. Therapists who don't set clear boundaries. Boundaries are very important. For those reading all of these and wondering if their therapist is terrible because they have one of these traits, just remember, if you feel your therapist is helping and you can point to moments where they have positively changed your mindset on a memory, situation, schema, etc., then they are good for you. Someone else said it well in here: a therapist match is like a dating match. A good match for you is full of red flags for someone else. A therapist won't be perfect either. They should stick to what they were trained on and not try to dive into untrained territory because they feel you need it. The difference is a good one will explain that to you, and it's up to you to decide if their technique is compatible or not. They are a teacher at the end of the day. They should help you add to your toolbox to become happier with your life. I hope everyone reading this thread finds the tools they need. I'm in a Masters of Counseling program right now, and one of our professors says his 2 rules are this: if the therapist is not in therapy themselves, run, and if the therapist is not in some kind of consultation with other therapists to get other perspectives their clients, run. I tried taking to a therapist about abuse I'd suffered as a child. She shut me down and said we should be talking about positive things and looking forward to my future. She did what every toxic adult had done in my life: tell me to avoid my trauma. What a poisonous therapist and experience. You have been visited by the romantic doggo. Comment love is magic so you never fall in the friend zone. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day, you magnificent people.